all, nearly 500,000 people are killed because of preventable hospital mistakes. That is each and every year. And a study done by Consumer Reports found a correlation between patients experiencing a lack of respect and an increase in mistakes. Here's what you can do.
Jacqueline Birnbaum is still scarred by her father's death 6 years ago in a Manhattan hospital. The recently retired 85-year-old had opted for a hip replacement to more fully enjoy his new life. The surgery was a snap. What he didn't bank on, being sickened by a hospital-acquired infection.
He had MRSA, I think was the first one that he got, and then he had the staph infection.
One after another, then antibiotic after antibiotic. He needed open-heart surgery to clear it of infection, then dialysis, and ultimately...
They said there was no hope that he would come out of it. So my sister and I had to make the decision to take him off life support.
And the Birnbaum family is not alone.
About 440,000 people a year that die from preventable medical harm.
When they're inside of hospitals.
That's right.
Consumer Reports undertook a sweeping study of why we get sick in hospitals. Their shocking revelations: 1,100 people a day have preventable drug mistakes. 29% of people hospitalized experience at least one medical error. 20% of people feel they've been discriminated against. And those who feel they rarely receive respect are 2.5 times more likely to experience a medical error.
When something happens like that, you get a hospital-acquired infection, the hospital staff will tell you, well, these things happen, you know, there's nothing we can do. It's not true. So the hospital has to be accountable for this.
In some ways, they're starting to be, and where it hurts, in the wallet. Medicare now reduces reimbursements when hospitals hurt patients by causing them to be readmitted, frequently because a mistake was made. Private insurers now trying to do the same, but there's a paradox. The sickest of patients rack up the biggest of bills, creating more profits for hospitals.
The hospital bills from those patients can be, 10 times and 50 times more than the other patient.
So how well are New York hospitals caring for their patients? Consumer Reports scored them based on data about infections, complications, and readmissions. Top performers included St. Francis and Rosalind, Hudson Valley and Westchester, and NYU Langone. The lowest on the list, Glen Cove Hospital, Lawrence Hospital in Bronxville, and Kings County Hospital. Some hospitals, though, have dramatically improved their scores by using simple but stringent protocols for things as basic as hand washing, even driving infection rates to zero. That haunts Jacqueline to this day.
The hand sanitizer was empty. The dispenser was empty.
Outside of his room?
Right.
Meant to keep hands clean?
Right.
And keep infection away?
Right.
And patients, too, can dramatically improve their chances of leaving the hospital alive. Start by asking questions. Make sure you have a friend or family member with you. Make eye contact with your healthcare professional. Be a real person. Leave pictures in your room. Talk about your interests outside of the hospital. Keep track of everything by taking notes, and make sure your doctors, nurses, and anyone else always wash their hands before working on you. Jacqueline wished she'd stressed that more for her own father.
It was really a crime that people who shouldn't die at this point in their life were dying.
So as shocking as these findings are about a culture of a lack of respect leading to mistakes, it's also encouraging that we as family members can do something about it. Having face-to-face eye contact conversations, making a patient a real person, and taking notes and asking questions. Suki and Corey, the most important of which, have you washed your hands? So anytime a medical professional comes in, and I know I said, even this, and I ask a lot of questions, as we all do, right? To ask a medical professional, a nurse or a doctor walking in, hey, have you washed your hands? If you don't see them doing it in the room, because that is the front line for preventing infections.